For the second year in a row, the opioid epidemic lowered Americans' life expectancy, and Ohio ranked tied for second in the nation in overdose deaths. 27 First News reporter Dan Marcel is live here in the studio. Dan, 39 in every 100,000 people die of overdoses in Ohio.
That's right, Mandy, and the numbers are not good. Thanks to new improvements in medicine, treatment, and care, Americans have enjoyed a steady increase in their life, at least in the last century, and in just the last 50 years, Americans have added nearly a decade to their lives. But despite all of these medical improvements and an increased age, a looming problem still lingers. Opioids are killing people younger and younger than ever before.
For 8 years of my life, all I wanted to do was die.
Brant Boland started taking painkillers when he was just 16 years old. At 19, he injected himself with heroin for the first time. It was the beginning of an 8-year-long addiction that ultimately landed him in prison.
I knew every 6 to 8 hours I had to inject myself or else I'd be deathly sick to the point where I couldn't function as a normal human.
Boland would wind up at the Ohio Valley Teen and Adult Challenge for rehab and is now working there, sharing his story with other young people.
And talk about drug prevention and share my mistakes and try to let people learn from the things that I've done.
Addiction to drugs has been a major killer in the United States. In 2016, 63,000 people died from drug overdoses, up 21% from the year before, dropping life expectancy in the U.S. for the second year in a row. Not uncommon, but the last time the U.S. had a 3-year decline was in 1918 during the influenza pandemic.
We really have to be honest with ourselves. We have to put away the stigma.
Hope Ann Lovrinoff Moran works for Ohio Change Addiction Now. Her work sees not just people in their 20s and 30s, but also in their 40s and 50s.
We have lost the war on drugs, and as long as there is a demand, there will be a supply.
Both Lovrinoff Moran and Boland think the problem needs to be looked at more long-term. Treatment programs that last 1 to 3 months are simply not enough for people to fully recover.
Post-acute withdrawal symptom, it takes 12 to 16 months for your brain to start to repair itself to be able to make a good decision again.
Both also want more education in schools, but they know it will be a while before any real change can be made. And despite the drop, the death rates actually did decrease for 7 of the 10 leading causes of death in the United States. But this also increases the gap between men and women. Men have a life expectancy of 76, women 81. In the studio, Dan Marcel, 27 First News at 5.